The silencer is a two-component articulated mandibular advancement appliance. The articulating element is a patented precision attachment. This dental device is designed to permit the advancement of the mandible through a controlled range of forward movement. The silencer overcomes joint and muscle problems associated with fixed position appliances by allowing vertical and lateral movements of the mandible. The silencer allows up to 6 millimeters of lateral movement and 1 millimeter of vertical movement while still holding the mandible in a forward position. The key feature of the silencer, which allows for this flexibility, is a patented precision attachment known as the Hallstrom hinge. The hinge is constructed from implant-grade 6-4 titanium alloy and carries a lifetime warranty for the patient. The Hallstrom hinge is the feature of the appliance which allows and controls the necessary movement of the mandible, while at the same time achieving sufficient advancement of the tongue to relieve both snoring and apnea. The body of the appliance is fabricated from a combination of elastomeric material and hard acrylic. The elastomeric material delivers a measure of comfort for the teeth and supporting structures. The hard acrylic is used to retain the hinge and also acts to increase retention with cross-arch bracing and to hold any necessary clasps. In addition, the cusp tips rest in hard acrylic, which acts to maintain tooth position. There are also hard acrylic bite pads, which are used to provide support to the dentition as well as the temporomandibular joint. In private practice, the silencer has proven effective in a high percentage of the cases treated. The silencer is effective because it moves the tongue forward and out of the airway. In this first MRI view, consider the patient to be in a supine position with the tongue crowding the airway. With the silencer set at 60% of the pertussive capability, the airway is more open. However, the soft palate and the uvula are still resting against the posterior wall of the pharynx. The silencer is now set a further 2 millimeters forward. The soft palate and uvula are now lying against the tongue, leaving the airway open and unobstructed. The silencer is now 2 millimeters further forward. The airway is even further open. This is an axial view of a small airway without the silencer. With the appliance set forward, the airway is much enlarged. The silencer allows gradual advancement of the mandible to open the airway. The silencer may be fabricated on working models taken from alginate impressions. However, it is very important to use a rigid tray. Never use a disposable plastic tray because there is insufficient support for the impression material. Always allow the impression material a full set before removing it from the patient's mouth. The optimum amount of advancement is the minimum amount required to provide relief from the symptoms of sleep apnea and snoring. The silencer allows incremental advancement of the mandible, assuring that the mandible moves forward no more than is necessary for successful treatment. The role of the silencer bite technique is to take advantage of the appliance's unique features to provide maximum flexibility and comfort for the patient. The silencer kit comes complete with the patented Gothic arch tracer. Components of the Gothic arch tracer are the upper or maxillary clutch with a threaded hole for the tracing and positioning stylus, the lower or mandibular clutch with a mandibular tracing plate, a threaded double-ended stylus. One end has a drafting lead, the other end has a spring-loaded positioning stylus. To start the bite technology process, place impression putty in the upper and lower clutch plates. Insert the clutches. Place the separating plate between the two clutches. The separating plate keeps the putty material from commingling and locking the clutches together.
Bite down.
Move the putty material around the edges of the clutches to obtain a good fit. Hold the clutches to maintain them in the midline position until the putty achieves initial set. It is important to do this because the occlusal plane is not necessarily level, which can result in the tracing area deflecting to one side.
Okay, open Randy, please.
From this point on, the separating plate will no longer be needed. Now carve away the excess putty from both clutches. To prepare for the bite registration, place a post-it note on the mandibular tracing area. The sticky end of the note should be away from the patient on the front edge. Bend the tips over the tracing area. Thread the stylus into the maxillary clutch with the drafting lead down. Place the clutches back in position. When the clutches are in position, they will be in contact in the posterior, but in front they should not contact so as not to move or interfere with the post-it note.
Forward, back, forward, back. From there go right, back to the center, to the left, back to the center, out to the left, back to the center, far back as you can go, up to the left now. That's it, you're done. Perfect. Okay. Now, what we have is a perfect Gothic arch tracing. Describe our range.
The Gothic arch tracer has diagrammed the patient's range of motion. In this case, the range of motion is 10 millimeters. Ranges of less than 7 millimeters may be a limiting factor for successful treatment. There is no restriction of movement to the sides. We have also established the patient's midline. Take 50% of the midline and make an X. Using a number 6 round burr, drill a hole through the post-it note and through the mandibular tracing plate. Write the patient's name on the post-it note and place it in his chart as a permanent record. We now have a guidance hole in the tracing plate which establishes the exact position for the silencer. Now cut out the impression putty from the heels of both clutches. Be sure to expose all the holes. Rethread the stylus with pin end down. Mix more putty and place the material in the heel ends.
We're ready to go back to the mouth.
Good.
Okay. Bottom ones goes in first. And bite firmly. Grind from side to
Make
side.
sure the putty is squeezed out to form a good bite registration. When the pin engages in the hole, tighten down the stylus. Massage the patient's cheeks. Because there is no registration material on the anterior, support the Gothic arch tracer as you remove it. This keeps the two pieces from tearing apart. The bite registration is now complete. This goes to the laboratory along with a set of impressions. When the patient's silencer comes back from the lab, it is assembled. Disassemble it using the supplied screwdriver. The screwdriver has a 1.5 millimeter hex which is not readily available. This helps deter patients from attempting to adjust the appliance themselves. Place the upper portion of the silencer. Check for fit. Place the lower portion. Check for fit. Check the bite for balance. Check with articulating paper to make sure there is good solid contact on both bite pads.
Okay. Okay.
If the contact is not correct, adjust it with acrylic burrs and repolish. If necessary, grind in the bite pads using milling paste to achieve an absolute balance.
Bite. Forward and backward.
Once you are satisfied the bite is correct, that the patient is comfortable, and that ingress and egress are easy, reassemble the hinge. Place the retention screws back into the mandibular component. Make sure they are fully tightened. When reassembled, do a final check for fit and comfort. The patient should be recalled at 2-week intervals for monitoring. The appliance is adjusted to bring the mandible forward in 2 millimeter increments until the symptoms are relieved. Here are some common problems you and your patients may encounter and some suggestions on how to deal with them. If patients complain of sore temporomandibular joints, the cause may be too much advancement. The cure for this is to move the silencer back 1 hole at a time. The same complaint may also be caused by unbalanced bite pads. Check the pads and mill them if required. If the patient is fighting the silencer or clenching, suggest that they take a few nights off. Also check that the bite pads are balanced. If the problem is tender anterior teeth, the silencer may be too tight. Check for undercuts and also check the clasping. It is normal for patients to experience increased salivary flow when they start using the silencer. This problem will usually subside after the first few days of use. Unpleasant taste can be caused by poor home care. A better cleaning regimen can cure this problem. Non-compliance is another issue and usually requires counseling and consultation with the patient's physician. It is important that the patient fully understand the health risks posed by OSA. Please remember that snoring and sleep apnea are medical conditions. It is important that your silencer therapy be delivered in consultation with the patient's physician.
There were times when she'd have to poke me to see if I was still breathing, because I did have an indication of sleep apnea where I'd actually cease breathing, and I wasn't aware of this.
And I would lay there and I'd count 1, 2, 3, 4, and then I'd go and punch him sort of to see if he was going to be breathing again. And of course he'd go like this and he'd start breathing right away.
The cessation of breathing, I believe, hastened my heart problems. Certainly I was very young. I was only 46 when I had the double bypass operation.
We discovered I was unable to stay awake for any length of time during daytime, which was had some embarrassing features to it, particularly when you're working in an office. I'd fall asleep while I was talking on the telephone, or I'd be dictating a letter and I found myself falling asleep in front of my secretary.
The noise level of sleeping with a snorer of someone like my husband makes it impossible. It's almost as loud as a pneumatic drill when your head is that close to someone else's on a pillow.
Well, my motivation for seeking treatment was that I started to develop a fairly significant snoring problem. Wasn't as much a problem for me as it was for my wife. You know, she would constantly have to wake me during the night in order for her to be able to sleep. And it started off just an occasional, once a week, once every couple of weeks. And as time went along, I became a much more regular snorer, and so I started looking for answers.
The symptoms I had that were most troubling were falling asleep at night and waking to gasp for air, or not being able to fall asleep and seeming to need air, having to actually sit right up in bed or sit over the edge of the bed. A terrific amount of nighttime breathing problems.
The most problematic symptom that I had with my snoring and sleep apnea problem was morning headaches. I used to wake up in the morning and have a headache, and as a matter of fact, in the course of the night I'd have a headache. I'd wake up in the morning and I would have this headache, which would last an hour or two after I got up, and then it would disappear.
I went to my family doctor. My family doctor referred me to the University of British Columbia Sleep Disorder Clinic, and there they wired me up with bells and whistles all over my body and tested me out. And they just couldn't believe the horrendous noise that was coming through and the severe sleep apnea I had.
She took my blood pressure and she just calmly read it. It was 122/82 and 124/80 and wrote it down. And I thought, gee, that's great. And it was some time later before I realized that in nearly 20 years my blood pressure had never read out at that level.
It was just as different as day and night. It was like one night I didn't get any sleep, and the next night, I mean, actually I didn't get any sleep either because I stayed awake waiting for it to happen, and it didn't happen. It was absolutely amazing, absolutely amazing.
Since I've been wearing a silencer appliance, because I have stopped the sensation of breathing and I'm breathing normally while I'm sleeping all night, I wake up much fresher in the morning, and I don't have that grogginess. I don't have the dry throat anymore, the sore throat. I just feel like a different person in the morning.
When he started wearing the silencer, his results were immediate. I know not everybody's are, but his worked that night. And it was such an unbelievable thing to hear silence that I stayed awake listening to the silence.
Well, the silencer has made a complete change in my life. It's opened all of the vistas I used to have before. I no longer have the tired feeling. I sleep well.
Once I had the silencer appliance, I found that my sleep did improve, though. And I found that, in fact, where I didn't know that I was tired during the day, in fact, I really was. I was much more rested after wearing the silencer.
The effect of the silencer has slowly but surely been wonderful. I think between the two, for the jaw movement, for the ease of knowing the jaw moves, for being aware now that, especially when I go to bed and when I wake up, that I am actually breathing. It is actually now full breathing all the way through, and there are times I actually just like to lay and do nothing but breathe. It feels so good.
As far as I'm concerned, it's something that everyone should, who snores and has a problem where it's creating difficulties either personally or with their mates, they should really look into this.
Instead of stopping breathing 350 times pre-operation to 250 times post-operation, I'm down to 3 times in one 7-hour period. My oxygen level's gone from, it was a low of 14% all the way up to 96%. My heart rate was 122 at its worst, and now my heart rate, I'm in the 60s when I'm sleeping. Major, major differences.
Since I've had the opportunity to introduce this appliance to patients in my practice, one of the things that I particularly noted is that they have responded positively because they feel that I've contributed dramatically to improving their quality of life.